What happens if hearing loss is not treated?
So there's the first population group that we need to talk about is the pediatric population group. If you have a child who has hearing loss, so in children, the commonest cause of hearing loss is middle ear disease. In fact, 80% of children in the first 5 years of their lives will have some degree of middle ear problem. Often it goes unnoticed, but sometimes it can become significant in that the child will have repeated middle ear infections, or they'll have presence of fluid in the middle ear, which persists and causes a hearing loss. The effect of that hearing loss is that the child goes through their first few years of life when they are primed to develop speech without being able to hear well. As a consequence, they can have problems with speech development. So they end up having delayed speech in which their speech ability is not the same as their peers, or they can have problems with pronunciation. If the child has a profound hearing loss, we spoke about this earlier, if they're not rehabilitated by the age of 1, there's a very high chance that they would go through the rest of their lives without being able to hear, speak, and function normally in society. With regards to adults, I think we touched on this in a little bit earlier. If you have an adult with a hearing loss, they become less productive to society. Somebody sitting in an office and unable to hear, unable to communicate with their colleagues, in any sphere of the work environment, will not be as functional as somebody who has normal hearing. In the elderly population, it becomes a problem of social isolation and progression to dementia. So what we're saying is that if you have a hearing problem, we need to identify what the problem is. We need to find out what the solution is so that we can improve your chances of having a normal quality of life and not having to undergo or to have one of those negative outcomes.
Okay, awesome. What level of hearing loss requires a hearing aid?
The way we measure hearing loss is in decibels of sound. So normally our ears are able to hear, normal hearing is between 0 and 25 decibels. So that's the way normal hearing is defined. Anything above 25 decibels is regarded as a hearing loss. And hearing loss is graded into mild, moderate, and severe, profound, depending on the number of decibels required. Hearing the sound, we have to also understand that speech is multiple sounds that the person hearing has to be able to understand, or has to be able to perceive and to be able to understand what it means. So when an audiologist assesses a patient, they assess their ability to hear sound as well as their ability to understand speech. A patient will require a hearing aid when their audiogram suggests that they have a significant hearing loss and they have problems understanding speech at a certain level. However, the ultimate decision lies with the patient. Somebody with 40 decibel hearing loss might be able to function normally. In other words, they don't feel that they're disadvantaged at work. They communicate well. They're not able to, they don't have any problems hearing the car hoot around on the street. So those people don't require hearing aids. However, you have other 40 decibel hearing loss patients who find. So it all depends on the patient's subjective experience. If they think that the hearing loss is significant to cause them to be missing out on conversation or having problems with communication, then they should consider hearing aid. The other reason to consider hearing aids early is that If you go through longer periods of time with hearing deprivation, it results in problems with the central connections, the brain's ability to understand speech if you try to rehabilitate them after many, many years of hearing deprivation.